everyone, and thank you for joining us today. Those of you that are familiar with PRI may have realized that I'm not Olivia Rope. She unfortunately couldn't make it, but I'm really pleased to moderate today's discussion and the launch of the new 10-point plan on crisis-ready non-custodial sanctions and measures. My name is Trina Lenihan. I'm the Policy and International Advocacy Manager at Penal Reform International. We'll also be hearing from the project funders and partners, the International Penal and Penitentiary Foundation shortly, but just before we get started, a couple of housekeeping points. Firstly, the webinar is being recorded and the video will be available on our website later. We have simultaneous translation available in Russian, so you will need to choose your preferred channel in the interpretation box towards the bottom of your screen. During today's presentations and discussions, the chat box is open, so please put any comments in there. You're welcome to introduce yourselves, tell us where you're joining from, and any questions for the panelists can be put into the dedicated Q&A box. So we'll be monitoring the Q&A throughout the event, and there should be some time for questions and answers at the end of all of the presentations. So questions for the panelists, please, in the Q&A box rather than the chat if you can. We'll remind our speakers just to keep to your time, so we have that time at the end to address any of those questions, and we'll jump straight in. So I'll hand over now to Dr. Piet-Hein van Kempen. He's the Secretary General of the International Penal and Penitentiary Foundation that is supporting the project that today's event and the 10-point plan stem from. The project received IPPF funding in support of the Foundation's goal to ensure that criminal justice systems equitably and effectively deal with the impact of COVID-19 on individuals who are either custodial or non-custodial settings. We'll hear some opening remarks and about the context of the project from IPPF's perspective. So over to you. You're on mute, sorry.
I did it again, even after those many years. Good morning, everybody. Thank you very much for giving me the floor. Indeed, I'm Piet-Hein van Kempen, Secretary General of the IPPF. And the IPPF has funded this project, and we hoped, of course, for a very useful outcome. And I can indeed say that we are very happy with all the work that has been done on non-custodial sanctions in times of crisis. And what I find particularly strong about the project, not only that it has looked at many different countries, and not only that it is useful right now, but that it also takes a view to the future and is actually come up with a 10-point plan, an instrument, you could say, that will also be very useful for the future. And it means that even if the crisis at some point will end, and we of course all hope that it will end rather sooner than later, then there's still a lot of work to be done, because things like this can also happen in the future, of course. And this plan is an excellent tool to address such situations. So I would like to thank everybody who was involved in the project and put a lot of energy and work in it, and I'd like to congratulate you on the result. And furthermore, I look forward to the discussion we will have in a minute. Thank you.
Thank you for that. So I think that's a very good point about the sort of future and forward-looking prospect or the focus of all of this work. So without further ado, we'll go on to our first presentation. We have Professor Anabela de Miranda Rodriguez, who is professor at the Faculty of Law of the University of Coimbra and head of the Criminal Law Department, a member of the IPPF, and is leading the project team at University of Coimbra on the two projects we're jointly conducting on non-custodial sanctions and measures. She will be presenting on findings from an ongoing comparative study across 21 EU member states. So over to you, Professor.
I'm going to jump in here just quickly, Trina. I don't think Professor Annabella has joined us. Or Professor Annabella, if you've joined through the regular link, you would have to go through the panelist link in order to be able to present. Maybe for consideration of time, maybe we can jump into the next presentation and while we wait for her.
Sure, I don't see her in the attendees list, so let's move on and we can come back when she joins. So if you're ready, we can go to Mr. Ruslan Romanov, who is head of the monitoring department of the Kyrgyz probation service under the Ministry of Justice of the Republic. He has been centrally involved in the continuous development of the country's new probation service, which became operational only in late 2019, so just in time for the pandemic, and will be presenting on the efforts and approach that the probation service took in managing the impacts of the pandemic on the delivery of non-custodial sanctions. So over to you. You're on mute, sorry.
Можно будет включить микрофон?
Would you please turn on microphone? Thank you very much. Thank you. I'm very happy to meet all of you here, even though we are in online format. For us, it's a great honor. So regarding the topic of what we decided to discuss today, I will try to fit the time provided. Just briefly, I would like to give you some history. As you know, you just mentioned that at the beginning of the fourth quarter of 2019, basically from the September 1st, 2019, we became operational, our service was established, and now we have more than 2.5 years in total. Quite young state service, I would say. We were established based on criminal proceeding inspections of the penitentiary service, which were before under the government. As of today, it's also one of the department, which is equally as us, is under the structural department under the Ministry of Justice of Kyrgyz Republic. Regarding what we regarding that we were established quite fast, actually, September 1st, even though it was initially planned to establish the service from the January 1st, 2020. And in 2019, we all started to work with new legislation that came into power. As you know, we had the new criminal code, criminal procedural code, and it was also was some facilitating factor in our practice. So after 6 months, as you all know, we faced big X-hour tremendous challenge related to the pandemic of COVID-19. In the full measure, I would say, and out of all our departments, one territorial department was affected the most, where we had a big number of population living there. So of course we had number of clients, probation customers who we supervised. And at that district, state introduced emergency plan and lockdown measures. So looking back, I would like to note that as a structure, we have a department of probation. This is the central apparatus, and we have 3 regional offices, which covers all 7 oblasts of our country, including capital of this country, Bishkek. Also, those 3 regional departments have 50 territorial probation services on the level of district, on the level of cities. So one of such department was facing these challenges the most, because there were situations where people coming from the Hajj, and there was the first wave of infected people coming to this country, and it was spread all over. So at that particular time, we started to observe the situation and decided to take certain measures. Right from the lockdown introduction, we had ideas what we should do. And as all of you know, the lockdown, the limitation of mobility between administrative districts, including passing the borders, and also there was so many block posts. The school universities were closed, people were working from home, and also institutional facilities or educational institutions also were closed. So the whole situation as it is set certain rules and affected our work. So what we did at that point, first of all, we understood that there will be many people who will get infected. And what we decided to do, we decided to transfer all our customers under the supervision to online format. Basically what it means, we remotely control them. Why? Because in order to avoid close contact, in order to avoid spread of infection, and considering all those limitations that were introduced, we used mobile phone mostly. We supervised them by phones. Of course, we activated number of calls. For that, we have the surveys, and we have the personal information of our customers, including phone numbers of their relatives. And what we paid attention to is we were asking what is his health status? What is the health status of his family members or her family members, neighbors? And in general, we analyze situation in this residential area or village where the customer resides. Why we were asking this? In order to provide support for the headquarters, for the special emergency centers, in order to notify them about the information so they can respond. Next, in some districts or in some areas, we had, and it was the situation actually nationwide, we automatically transferred all of our employees based on, first of all, it was the order of the government, and it was also our internal rule, internal order. We decided to work by shifts. What we decided to do back then, we didn't have at that moment automized information system to supervise our customers, probation customers. So the issue of digitalization was still ongoing. And right from the establishment, or right from the introduction of lockdown, we started to develop the TOR, even though we faced it, we didn't expect it. We didn't expect so many changes. We didn't have the electronic documentation. And at that moment, it was quite hard. First of all, we had the paper document. We used to work with the paper documents back then. So what we tried to do, we decided to do shifts. Some of our staff were working in the office, and we planned it by shifts. because many judicial structures were still working. There were court hearings, there were decisions made related to the imprisonment as well, and particular in the area of work that we doing, you know, what kind of challenges. There is some procedural norms that directly affecting our customers or inmates, particular considering the violations of their rights in order to not keep them for in pretrial facilities. So for that, our staff were forced to go to work to the office, and it's also had certain complications. Another problem that we faced, it's a lack of the personal protection equipment and items. Even the regular masks, medical masks, which according to in our national currency, it's a 5 som. It was quite cheap, but back then the price would growing tremendously up to 50 som or 10 times more. And some disinfecting items were also, we were lacking them. We didn't have enough personal protection items. So we tried to apply to the non-governmental sector through the medical facilities to supply our employees. Our employees, of course, were also going on the field trips. They were visiting customers of probation because on the initial stage, we had to set some kind of rules. And at that time, the border were closed. So we didn't we didn't expect that someone will violate the court decisions. But the active phase, so-called active phase, was of the crisis was in June 2020. And it was, we called it Black June and Blue July, where we had a lot of people who got infected very, very seriously. The hospitals were overloaded. There were no empty beds, and of course, it was a big burden on and workload on our employees. At that moment, we didn't have enough personnel in our department that we supposed to have according to the legislation and according to the primary plan. Many state authorities were closed, and the staffing has a certain instruction, the staffing process. So it should take at least 3 months for the testing, interviewing, etc. But the specific of our work also showed certain results, and at the end, I will definitely share them with you. So regarding the vacancies, from the September 1st, 2019, in the penitentiary system, we, out of 140 employees that we were supposed to have, we had only 80 people. By the end of the year, we recruited additional 20. So in total, we have around 100 personnel. And we had many customers, so I can surely say that we did manage the workload by existing staff. And we had back then around 10,000 probation customers on all 4 types of probation that we introduced. Also, one of the main work that we were supposed to do, the social work, including help or support with employment, educational support, obtaining the documentation, necessary documentation, registration, medical insurance, and etc. And also medical and social services, obtaining different social benefits, compensations or pensions. and of course, reconnection or resocialization of the social, resocialization in society. And also another area of work that we were supposed to do is rehabilitation and psychological support. So those directions related to the reintegration were completely frozen, and we didn't manage to fulfill the plans that we were supposed to do according to the legislation. Basically, what we did the monitoring and supervision. We supervised our probation customers and did it remotely. So in the future, further on, according to the legislation, all those activities were supposed to be implemented through the individual plan for the social and legal aid. But at the same time, I think we still have some positive dynamics and we have some positive findings, like, for example, volunteers. We had a lot of volunteers, and according to legislation, we do have it. But unfortunately, at that moment, many people didn't want to serve as volunteers. And but during the crisis, we had many volunteers who were providing support. We didn't even expect so many people to be so active. Even the probation customers were helping themselves. We had a very good example that one of the pain point for us where we had so-called red zone. It was the new building, hospital, field hospital, and it was provided, and it was also supported by our department, and our customers, our probation customers expressed their willingness to help in this red zone. So we were supporting the doctors. We were trying to support other field work related to the crisis with COVID-19. So public works were actually activated, and our customers who were under supervision expressed their willingness to serve. For example, bring some necessary items or some heavy physical work that were refused by other staff, or they were serving actually in this red zone, helping people. Partially, we solved problem with unemployment. Of course, it was positively affecting our customers, and it was one of the very bright example in the good practices. Also, I can say that it's pushed us to the fact that some of our customers, as well as our personnel, we organized special activity. We were supporting law enforcement officers. We were bringing them free hot meals. We were trying to help them to establish some kind of field tent. As I said, providing heat meals, or we were providing transportation for people got infected. We were trying to deliver them to the medical centers. And I think it's pushed us to also improve our work on digitalization. And I can surely say now that the youngest authority, who were one of the first were integrated by the end of 2020, beginning 2021, we started this automated database, informational base. It's a unified database of the crimes and misdemeanors. There were many tries to integrate the system and connection to this national global network. This work were actually implemented for last 5 years. And for the last 5 years, they were trying to do so. But unfortunately, some of these authorities still didn't connect to this database. And we are the only structure that managed to do it so fast. So we have the penitentiary, post-penitentiary, pre-trial, probation areas, and all of them are connected now. We are on the stage of piloting, and the third sphere of probation now is on the test mode. So we're always reviewing the efficiency, and we want to transfer all our business processes into the digital format in order to have more efficient exchange of information. So our probation customers won't just, go through the bureaucracy.
Sorry to interrupt.
In this
Can I ask
format,
you to make some final points and wrap up? Thank you.
И вот, подведя итог.
yes, thank you. Just to summarize, and we need to know the following. First of all, we need to integrate and introduce automated system, which we have already about 80% operational. So we're now transferring our process to the automation, integration, and work with other state authorities all over the country. We included many councils in the regions to involve different state authorities, agencies, to help with probation. That was addressed and done, and interaction with the non-governmental sector, NGOs, and international sector to help and facilitate the probation. We are actively working on that area. And we hope we will continue in the same format, working further and strengthening capacity of our staff officers. We have introduced some changes in the legislation so that our staff could be hired in a simplified format, because that's what the problem. It is almost addressed and resolved. Plus, the salary increase was also is taking place. The last thing I would like to say, what is related to legal framework after new legislation was introduced since year 22, January 1st, all things raised by non-governmental sector, all the collisions in general were addressed, almost all. And as of today, we have prepared, the template, or we're prepared to move forward, thinking with the consideration of PPEs, antiseptics, and that was briefly it. That's all from my side. Thank you very much. Over.
Thank you very much. It's so important to hear the experience, and particularly from such a new service. And we're always very happy to hear support for increased engagement with NGOs. So we'll move back now to our previous but next speaker. So thank you for joining us, Professor Anabela de Miranda Rodriguez from the Faculty of Law at the University of Coimbra. She's a member of the IPPF and leading the project team at the University of Coimbra. So over to you. You're on mute, sorry.
Thank you so much. I would like to greet all the participants in this event on behalf of the University of Coimbra research team. My name is Anabela Miranda Rodrigues, and I'm going to first briefly present the findings of our report on Portugal, and then some key findings on the comparative European report. About Portugal report, I would highlight 8 points. In Portugal, approximately 2,800 persons were released from prison due to the adoption of exceptional legislation that, in general terms, provided for a range of measures aimed at reducing the prison population and allowing for much needed space inside prisons to allow for physical distancing, the separation of those more vulnerable to COVID-19 and the isolation of those infected or quarantined. Those extraordinary measures consisted of collective pardon of prison sentences up to 2 years, individual pardons for persons more vulnerable to the virus, extraordinary prison leave of 45 days, renewable for subsequent periods, with the duty to spend it in home confinement, and extraordinary early conditional release. The results were positive. The number of recalls to prison were relatively low. There was no significant adverse reaction in society. And most importantly, it proved crucial in preventing the spread of the virus inside prisons. So far, there have been no recorded deaths in Portuguese prisons from COVID-19. On the other hand, the sudden release of numerous individuals from prison made clear the lack of effective preparation for release that was already a problem before the pandemic. Non-custodial sentences also suffered negative impacts, such as the suspension of group rehabilitative activities and other programs, higher demotivation among probation clients, and increased difficulty in finding employment. What stood out from the study was the professional dedication and ability to adapt to adversities shown by probation officers, and also the fundamental role played by civil society organizations supporting individuals released from prison. Positive impacts were also noted, such as enhanced use of new technology, which brought new opportunities and allowed some activities to be performed more efficiently. The use of video links to allow the courts to hear probation officers was pointed as a good practice, and it affords significant time savings. As to sentences that were supervised through electronic monitoring, such as home detention, they were the most easily adapted, as by their very nature, they were already monitored by remote means. Despite the benefits of new technology, some groups were unable to use it and cannot be left behind, such as older persons, persons with limited or not literacy or with mental health conditions, and the economically vulnerable due to a lack of computer equipment and inability to use electronic platforms. The comparative study encompassed 21 member states and was based on reports prepared by national experts and also interviews with representatives of national prison and probation service. This happened in some cases. We sought to identify common problems and difficulties, compare the measures taken to deal with them, and highlight examples of good practices. I'm going to present some key findings. With regard to the work of probation services, the EU member states experts unanimously convinced that face-to-face intervention is vital to rehabilitation activities, and so personal contact cannot be fully replaced. However, it can definitely be well complemented by digital means of communication as long as it does not reduce or replace human contact and respect personal data protection regulations. Also, the experience of remote working revealed that some tasks can be made from home, sometimes more efficiently in some countries. Efforts are currently being made to keep remote working, but in the form of a mixed regime. The potential of new technologies to play an important role in the criminal justice system imposes the pressing needs for adequate equipment and training of staff. The research revealed the lack of adequate equipment in some states and the need of probation staff to increase their knowledge and skills in working with individuals online. The pandemic brought to light underlying problems and deficiencies of prison and probation systems, such as the lack of preparation of individuals for liberty, insufficient probation staff and resources, the waiting lists for implementing non-custodial sentences, the socio-economic vulnerabilities of most persons in contact with the criminal justice system, and the lack of sufficient responses to support them. Among non-custodial sentences, community service was the most impacted by the pandemic due to the impossibility to continue work for many different reasons. Diverse solutions were provided, such as the interruption of the execution of the sentence, the modification of the workplace, or adaptation of the original text, or the replacement of work with other obligation. With regard to persons in vulnerable situations, the research concluded that persons with health problems and individuals in situation of socioeconomic vulnerability, especially unemployed and homeless people, suffered in an increased manner the negative impacts of the pandemic on probation service. Concerning the prison population, while most member states have adopted measures to avoid physical contact with the outside world by suspending visits, transfers, leaves, work, and other activities, some member states also decided to reduce the prison population by suspending the implementation of sentences of imprisonment or by releasing individuals through non-custodial alternatives, early release, or pardon. One of the main lessons of the pandemic was that emergency laws in many countries allowed a significant reduction of prison population without causing an outbreak of delinquency or increasing recidivism rates. The possibility of serving imprisonment sentences outside prison under electronic monitoring system, the measures to avoid short prison sentences, and the development of non-custodial sanctions were highlighted as good practices of the pandemic that should be promoted also afterwards. Finally, more detailed data collection by prison and probation service would be instrumental for a more thorough knowledge and for measuring the impact of changes in law and practice of criminal sanctions. Thank you very much.
Thank you, Professor Rodriguez. That's a real whistle-stop tour of what is some very in-depth research. So we'll invite everyone to read all of the reports in more detail as well, and remind all the participants that you can put your questions for any of the panelists into the Q&A box, and we'll have some time at the end to come back to all of the speakers with your questions and comments. So do take advantage of that. In the meantime, we'll move on to our next speaker. Dr. Adele Lukovics is a legal officer at the Hungarian Helsinki Committee, a key partner on the project. She'll be presenting findings from the country research in Hungary, particularly focusing on the experience of non-custodial sanctions and measures during the ongoing crisis from a client perspective. So please, you have the floor.
Right, thank you and welcome everyone. I would like to share my screen because I have some slides. Can you see them?
Yes, we can.
Okay.
You might want to go to screen sharing. We can see the full window of PowerPoint. So if you want to do presentation mode, it's up to you.
Sorry?
There might be a presentation mode, maybe the play button on the top left, if you prefer, but we can see them anyway. We just see the next ones also on the side.
Okay. Right now, I'm afraid I don't see this presentation mode. So
okay,
if
we can continue like this, it's fine.
But you see my slide.
Yes.
Okay. So
You can push F5.
Okay, so thank you very much for the opportunity to share the experience of the Hungarian Helsinki Committee on non-custodial sanctions from a client perspective. So I would like to summarize the main findings of our report made in the framework of the IPPF project. So right now I'm speaking about the second slide. Can you see it?
No, you'll need to click maybe to the right or click on number 2 on the left.
And now?
No, on the row of slides on the left, if you click on the second one.
I think you should unshare and then share it again.
Because in my
now it works.
Right now, okay.
Yes.
So on the second slide, you can see just the co-founders of the project, and right now it is the third slide that I want to say a few words about. So just shortly as a starting point, I would like to share with you our basic perspective on the current situation in Hungary on this topic. So as you can see it on the slide, Hungary's criminal policy needs to be reviewed as the use of alternative non-custodial alternatives to detention should be promoted. The European Court of Human Rights ruled in Bargain Others versus Hungary pilot decision that reducing the number of detainees by using non-custodial punitive measure more frequently was a solution to overcrowding, even more so when states are not able to provide detainees with condition of detention in line with Article 3 of the Convention. And now, I would like to say a few words about legislative changes introduced in our country due to the pandemic, just as a framework that can give a basis to present these changes from the perspective of the clients. So one of our main findings is that These legislative amendments didn't transform the system of penalties and measures and didn't introduce more lenient alternative sanctions with respect to the pandemic, nor any other rules aiming at the early release of detainees or applying more lenient penalties to them for the protection of detainees and, of course, for the protection of the prison staff. We can state also that, according to our findings during our research, none of the rules introduced as a reaction to the pandemic responded specifically to the needs of vulnerable groups or groups with any protected characteristics. So if the system itself hasn't changed, what has changed according to the legislative changes that were introduced in our country due to the pandemic? So legislative changes, these legislative changes solely amended non-essential rules concerning the application and execution of already existing sanctions and legal institutions, and only a few of them. So giving an example, we can talk about the suspension of execution of community service and reparation work, or there were some facilitations concerning the deadlines for their performance. And maybe as a result, I can give you a statistical fact according to which the number of detainees in penitentiary institutions practically didn't change in spite of the pandemic. That means practically that on 17th of June 2020, there were more detainees in Hungarian prisons than on the last day of 2019. And right now, I would like to share with you the four main points or main topics that I would like to shortly speak about as the effects of the pandemic in Hungary. So I would like to give a short analysis on the effect of the pandemic, on the imposition of alternative sanctions, on persons affected by probation, on early release and post-release services, and on vulnerable clients. As to the effect of the pandemic on the imposition of alternative sanctions, in the course of our research work, we made interviews also with judges and defense lawyers, and they told us about that after the pandemic has started. Practically, criminal justice has come to a halt in Hungary. It meant that, for example, courts aimed at proposing penalties that were acceptable for both the defense and the prosecution. Thus, the aim was minimizing the number of hearings. But there were also a high number of postponement of hearings, and simultaneously there was a high increase of the importance, role, and frequency of remote hearings before the courts. The defense lawyer told us that the pandemic could be a mitigating factor before the courts. So, for example, in the case in which someone has committed a crime against property because his or her existential situation has become unstable or uncertain due to the epidemic situation, that fact could be a mitigating factor in some cases before the courts. Another experience is that, as I've already mentioned, that the pandemic didn't affect the imposition of alternative penalties and measures, but it affected their execution. So giving an example again, we were previously talking about the execution of already imposed communities work or service and reparation work that has to be suspended. And this suspension had adverse effects and positive effects according to our research. So for example, adverse effects were in connection with the fact that both employees and employers would have wanted to get over with the execution of the imposed work, of course. But we observed some positive effects as, for example, new workplaces had to be designated after the end of this suspension, often with employers with whom probation officers hadn't had contact before. And these workplaces will probably welcome community workers even after the pandemic. As to our second topic, I would like to say a few words about persons affected by probation. So practically about probation clients. A big issue was, according to our research, or according also to our research, the issue of personal contact versus remote communication, because during the pandemic in Hungary, that was a short period of time in which probation officers and prison probation officers had to avoid personal contacts as a general rule. But after this short period from the 6th April till 31st May 2020, so after this short period from the 1st June 2020, personal contact became the general rule again, according to the Hungarian legislation, and means of telephone or electronic communication are allowed only in cases where the personal contact is hindered by the pandemic. But anyway, during the interviews that we made, probation officers concluded that, as a main finding, during the pandemic in their work, personal contacts and checks are essential with the supervised clients. So not just, evidently, not just during the pandemic, but in every time. So as you can see, hopefully the quotation on the slide, one of the interviewed probation officers said that you cannot do any supervision without any personal contact. And finally, to this topic, we can say that we observed that new or closer cooperation could be regarded as benefits of the pandemic. So, for example, probation officers have new cooperation with schools in the cases of the sentenced juveniles as a positive effect of the pandemic. As to the third topic, so the effect of the pandemic on early release and post-release services, we can observe a significant decrease in the number of positive decisions on early release on parole in 2020, while, and it's very important, so while the number of requests for release on parole submitted to country courts was not significantly less in 2020 than in previous years. And there was a similar tendency with respect to ordering reintegration custody. Reintegration custody in Hungary is when the individual is still under his or her sentence, but he or she can serve his or her sentence at home. So not the full time of the sentence, but a part of his or her sentence when special some special conditions are met. And a few words as to clients who were already on parole or reintegration custody. The individuals in reintegration custody reported some difficulties with electronic communication. For example, they had problems concerning the electronic monitoring system of ankle tags. And right now I won't read the quotation, but you can read here a quotation of a sentenced individuals who had a significant problem about the functioning of her ankle tag while she was in reintegration custody during the pandemic. As to the other findings, as to clients on parole on reintegration custody, for example, from November 2020 till summer 2021, correctional probation officers had to suspend personal contacts with clients, and it has an adverse effect. It had an adverse effect on personal supervision, but at the same time, they reported also that thanks to that, they could spend more time with clients who remained in detention, preparing them for release from prison. And as to the fourth, so the final topic, I want to speak about the effect of the pandemic on vulnerable clients. As main findings, we can underline that according to our research, the epidemiological situation must most probably intensify the already existing systemic problems and forced already vulnerable, less empowered sentenced individuals to an even more difficult situation. And it was the same situation as already sentenced person, because we can say that it became much more difficult for sentenced persons who were already vulnerable and had less negotiating power to arrange their release on parole or their placement to reintegration custody in penitentiary institutions. And we can also find that sentenced individuals were not informed by penitentiary institutions about the quick changing legislation due to the pandemic, so such as the different regulation of judicial decisions on ordering release on parole or reintegration custody. So they often didn't know what their rights and obligations were. And as a background, as you can see it also on the slide, we can say that a significant number of probation clients belongs to some disadvantaged or vulnerable groups in Hungary, like as persons living in extreme poverty, Roma, or homeless. And I will finish it in a minute or two, because I would like to speak about right now the final topic, because shortly I just want to say a few words about our recommendations that we made finally in our report. And here on the slide I collected the recommendations which are relevant from the client's perspective. Our first recommendation is because we had relevant difficulties during our research to find available and really adequate data. So according our recommendation, there should be systematical data collection on judicial decisions, alternative penalties and measures, release on parole, and reintegration custody, and this data should be made publicly available. For us, or according to us, it would be really important that defendants and sentenced individuals should receive broad, timely, and comprehensible information about legal provisions and practices modified due to the pandemic, as well as on their related rights, of course. According to us, that would be really important to increase the number of probation officers and prison probation officers. And finally, according to us, penitentiary judges should be encouraged to use release on parole and reintegration custody more widely in their practice. So thank you very much for your attention. And if anyone has any further questions, please feel free to contact me. Here you can see my email address. So thank you very much once again.
Thank you, Dr. Lukovic, for this overview of the research in Hungary, and importantly, the recommendations that can be drawn out of that for, addressing a lot of the challenges that we're seeing in many countries, actually, for clients, both now in the ongoing crisis and also for any future crisis. And that brings us very nicely onto our last but certainly not least speaker, Tanya Dayanova, who is the project manager at Penal Reform International, who has been leading all of this work from our side. Tanya will present the 10-point plan, which is based on the learning from all of the, the various research. So over to you, Tanya.
Thank you. I'm also going to share my presentation. Can you see that fine?
Yes.
Okay. Well, I'm very happy to round out our presentations with some key messages from the 10-point plan that, as you all know, we're launching today. And we at PRI, for one, hope that it will be a useful tool for many of you, as well as for probation services or systems of non-custodial sanctions and measures abroad in different varied locations. So we were able to develop this tool thanks to the support of the International Penal and Penitentiary Foundation, or IPPF. And thank you also, Pete Hein, for joining us today and supporting the project also during this event. Since the onset of the pandemic in early 2020, many governments and much of public discourse has been focusing on measures in the prison system, and perhaps rightly so. But the impacts of the pandemic on non-custodial side of criminal justice systems needs to also be acknowledged and understood. And importantly, it needs to be reacted on and addressed appropriately. This is, of course, because both as a direct consequence of the spreading virus and because of the impacts of release measures and restrictions that were adopted throughout the pandemic, probation agencies and others involved in the delivery of non-custodial sanctions and pre-release were significantly impacted. With services restricted or unavailable, and in many places increased and urgent releases happening, staff and probation clients alike found themselves in a situation that required quick and frequent adjustments, new ways of providing or accessing services, and that also resulted in needs and risks that could shift at a moment's notice. And all of this was often paired with limited information or resources, and often also no time to plan. So with that in mind, we hope to develop a tool and hope the research to better understand what is happening in the non-custodial side of things. The 10-point plan that we're launching today stems from PRI's and our partners' extensive research into the impacts of COVID-19 on criminal justice settings over the past years. This includes the EU comparative research that Professor Annabella presented on, as well as the in-depth country research in Kyrgyzstan, Georgia, Hungary, and Portugal. Some other research that we drew on included briefings that we've developed on the pandemic throughout the last 2 years, as well as more recent studies, for example, on vaccinations. The recommendations and the thinking behind the plan was also informed by our recently published guidance on disaster risk reduction in prisons. And finally, we're very grateful to have had a significant number of input from people with varied probation expertise from different regions and with different perspectives. So the plan, the many lessons that can be drawn from the experiences of those involved in non-custodial measures over the past 2 years came together as this tool. And it's intended to support probation services and others be better prepared, more flexible, and resilient in the face of any crises, including the current one. We believe that by acting on the recommendations of the 10-point plan, those that are involved in the delivery of community sanctions or alternatives to detention in varied settings can ensure services can remain continuously available and effectively and fairly implemented. Point 1 of the plan, government should seek through collaborative strategizing, including probation leadership and other stakeholders in the process, to reduce prison populations in a lasting way. By making sure that we are prioritizing reduced use of imprisonment at all times, sudden need for bringing prison numbers down or addressing overcrowding through emergency measures will be reduced. National strategies should include a greater focus on developing and implementing effective and constructive non-custodial sanctions and measures. And legislation should be put in place that has built-in flexibility so that it can be effectively utilized in times of crises. In this way, it can help avoid the introduction of hurried, less trusted emergency measures. There was an example from Italy in the comparative report where judges responsible for sentencing stepped in to play an important role in prison releases by using existing measures, quote, from an emergency perspective. And this helped kind of counter emergency measures limitations that were found and the limited applicability or implementation that was possible. To continue on from the first point, point 2 highlights the importance of investing in non-custodial measures in order to offer alternatives to imprisonment that are truly responsive and effective in supporting rehabilitation. Where they don't yet exist, probation systems should be established. Probation services that are already in place should be strengthened through increased political attention and resourcing. Sufficient numbers of staff have to be in place to support the flexibility that is required in times of crisis. For example, this can happen because caseloads suddenly increase, or the nature of work or the types of clients change due to a crisis like the pandemic or response measures that are taken. Budgets should include funds for varied and flexible service provision, for example, enabling partnerships with external service providers and supporting the use of varied means of technology appropriately. Service continuity has to, of course, be a priority, and especially so at a time of crisis. And human and institutional resources, including funds, should be secured for the development and implementation of individual rehabilitation plans and the meeting of specific client needs, including needs that might arise during a crisis. Clear guidance and procedures allow us to act quickly and effectively in the face of a crisis or emergency, including one like the COVID-19 pandemic that required urgent action to protect public health. Based on comprehensive risk assessment and extensive scenario planning, contingency plans should be developed with probation services working collaboratively with other stakeholders. It's very important that people in prison are subject to probation or other community measures, as well as representatives of civil society are involved in this planning. As an example, the National Council on the Administration of Justice brings together both state and non-state actors involved in criminal justice in Kenya, and it was instrumental in enabling a well-coordinated and proactive pandemic response across the justice sector there. To support continued probation services during a crisis and protect the rights of those serving probation or about to be released from prison, contingency plans should include communication plans, provision for extra resources, and establish clear lines of command. This will then enable quick decision-making and action when needed. Individuals in criminal justice systems have varied and often complex needs. A collaborative approach is something that's important to ensuring services meet these needs and effectively support the rehabilitative and safety aims of sentencing. Probation services should seek out a range of strong partnerships, including those with governmental and community service providers and volunteers. Close collaboration across the criminal justice continuum is also important to successful rehabilitation and reintegration, and it supports flexibility and responsiveness, which of course is key to crisis management. Some key areas for partnerships include employment support, opportunities for remote communication, training, and other programming, as well as the broader provision of support services to meet individual needs. These could include empowerment and motivational activities, housing, rehabilitation, and mental health support, and could be delivered both in person and remotely or in a hybrid way. During the pandemic, the importance of these kinds of varied partnerships was highlighted, for example, because community service provision was limited and many partners that probation services normally relied on for placements became unavailable, as Adele mentioned as well. Some probation services, including those in the Netherlands and in Georgia, focused on securing larger partners who are less likely to be impacted by restrictive measures, and broader collaboration with entities that can offer outdoor work, such as municipalities. When a crisis hits, or when it comes in waves and calls for continued shifts and adjustments like the current one, clear and timely communication is absolutely crucial. It helps make sure we work effectively and on the basis of the same information and standards. When added pressures and uncertainty abound, clear and open communication builds trust. To make sure any individual subject to criminal sanctions, as well as staff and partners involved in the delivery of services, are well informed on any rules, restrictions, or any changes that might impact them, establishing and maintaining good lines of communication has to be a priority. This should include sharing of transparent information with the public, as well as with families or networks of individuals in prison or supervised by probation services. Particular attention has to be paid to offering information in an appropriate, accessible, and varied manner, including online or over the phone communication in a variety of languages, and considering individuals with limited literacy. Individuals who are released from prison during a crisis should be made aware of any measures in place in the community that they should follow, such as curfews or travel restrictions or changes to services that are made available. One topic that has come up time and time again during the COVID-19 crisis has been the role of technology. This is also something that the previous presenters talked about. In order to benefit from the flexibility and the positive things and options that technology can offer for the delivery of non-custodial measures, staff and those subject to supervision and other measures should be enabled to use it appropriately. This can be done by supporting the development of necessary skills to use tools, by providing access to these tools, and by ensuring continued protection of privacy and other individual rights. Technology cannot replace the human contact that is central to offering effective and individualized assessment, monitoring, and support services, as my colleagues already noted, particularly so when it comes to the onset of probation work. This is because establishing trust and strong working relationships is notably more challenging remotely. And frontline probation staff that took part in our research also mentioned that work with clients who present higher risk or need levels is also difficult to realize through remote means. With that in mind, the role of technology should be seen as supplementary, with the limits of its appropriate use recognized and respected. Still, there are several areas in which technology can be a key to service continuity and adaptability, and these include records management, regular supervision activities, and the delivery of programming, for example, through virtual learning. And technological tools or the related skills can also improve working conditions and flexibility for staff. Making sure that the preparation of a person's release gets underway from the moment that they enter prison not only supports successful reintegration in general, but it plays an important role in increasing adaptability and release readiness when emergency release measures are adopted with very little notice. As part of release support, personal documents and information should be kept up to date, for example, with regard to community connections and the expected accommodation at the point of release. Sufficient information flow between prison and post-release services, including probation, should be a priority. While no person should be released into homelessness, it should not be the case that the lack of a permanent place of residence in and of itself disqualifies an otherwise eligible individual from early release or from other alternatives to imprisonment. And to make sure that this doesn't happen, services should work with community partners like halfway houses and support continued contact with family members. Similarly, cooperation with partners should also ensure continuity of care, for example, in providing mental health or medical support, including vaccines. In times of crises, the importance of clear and frequent communication is underlined for individuals preparing for release. Legal representation and other official contacts should remain available and accessible so that people can get advice on any impact shifting circumstances and measures might have on their case and circumstances. Just as importantly, continuous contact with loved ones on the outside should be supported, because this can facilitate social support during times of uncertainty, stress, and turmoil. Although both the crises and being in conflict with the law or in contact with the criminal justice system make any individual vulnerable, some groups of people are left with disproportionately low access to non-custodial sentencing options and measures. Some marginalized individuals or those in other situations that can increase vulnerability can experience compounded challenges and barriers, also while on probation or subject to non-custodial measures. Point 8, that's also described on this slide, emphasizes the importance of considering the specific needs of certain minority or marginalized groups. On top of this, crises often deepen pre-existing systemic issues and social inequalities, and individual needs and risks can also change as a result of shifting circumstances and unexpected events, making these kinds of considerations all the more important. Probation officers and services at large should be alert to any such changes in needs, assessing and prioritizing action accordingly. This was an example from Kyrgyzstan, where officers and NGOs work to make lists and offer targeted support for those identified as most vulnerable and their families, like was already mentioned by Mr. Romanov. And in Georgia, special attention was also paid to family circumstances, also something that was considered by parole councils or parole boards. So both in crisis and in non-crisis times, flexibility should be offered through the types of measures and programs that are available, and providing options for accessing them and meeting sentence requirements. Changes to any operation services or the requirements of a sentence should never result in discriminatory practices. Some groups that COVID-19 and the related measures and shifts may have discriminated against. And of course, this is important to also consider as the pandemic is continuing. Include groups such as those with limited possibility to communicate remotely. And this could be either because of limited finances, lack of technology skills, or language barriers. It could include those with caretaking responsibilities, such as women or parents, or those with a family member who has a disability or is at an increased risk during the pandemic. Furthermore, individuals in situations of homelessness can be discriminated against, as well as those relying on health services, because service closures can impact their access to necessary services and programming. And we're moving on. One of the key areas of our research was staff well-being and experiences during the pandemic. Probation staff has to be appropriately equipped, informed, and supported in the provision of their work so that they can be able to effectively and quickly respond to and adapt in the face of crises. When work is shifted partially or in full to remote mode, and when new tools are introduced or operational standards enacted, Training should be provided on how to deliver effective supervision and support while considering staff's own privacy and boundaries and ensuring respect for clients' rights, including privacy. In assessing capacity needs, resources needed for training, professional supervision, and support services for staff should be considered, and partners, including volunteers, engaged where appropriate. Staff well-being should, of course, be a priority, and varied means of support and flexibility should be offered, especially when there's shifts in working methods that are required. And when the impacts of crises extend beyond the workplace, this should be taken into account, for example, in considering responsibilities for caretaking or financial uncertainty. Staff safety should also never be overlooked, and probation staff alongside other justice actors should be considered essential service providers and prioritized accordingly during any crisis response. Justice services should always follow any relevant guidelines and implement measures advised by public health or other authorities during crises. And any crisis measures and shifts in working methods should be coupled with clear guidelines and continuous support. All in all, ensuring staff is always well informed of their role and duties and any changes to them, has the equipment and skills necessary, and has purposeful methodology and supervision to lean on, will make sure that it adds clarity and purpose to their work and to the support they can offer for crisis responses. And the final point of the 10-point plan, which to some might seem obvious or to others like a less important afterthought, is about monitoring, evaluation, and learning from the experiences and challenges that are brought upon by a crisis. This, of course, is central to proper crisis preparedness and risk reduction efforts. Thorough debriefs and, if appropriate, ongoing briefings should support monitoring and evaluation efforts. They should include a broad range of stakeholders, including probation clients, who can offer a different and valuable input on the information that's been gathered and who can contribute to contingency planning, as mentioned above. Just as importantly, though, focusing on learning can build institutional knowledge and provide evidence base for planning and practices in general. This happens, for example, when crises highlight systemic issues that are already pre-existing and the urgent need to address them. The momentum gathered during times like these that force us into action can be harnessed by probation services and criminal justice systems to realize necessary and sustainable change in a considered and purposeful manner moving forward. To make sure that important lessons are captured and acted on, data should be gathered systematically and made publicly available, like my colleagues also mentioned. Channels for knowledge sharing and discussing experiences should be opened, both internally as well as across regions and countries. And this is something that communication technology can be very well suited for, and it can support these kinds of knowledge sharing and learning efforts. So this is the end of the 10 points, and maybe I'll leave you with a few great examples of identifying lessons from the ongoing crisis. On a regional level here in Europe, the Confederation of European Probation, or CEP, has been gathering practices, lessons, and experiences throughout the pandemic into a COVID-19 database. In Portugal specifically, a multidisciplinary thematic meeting is being planned by a range of criminal justice actors and different stakeholders. The meeting aims to identify ways that the system can be improved, with a particular focus on the provision of social reintegration support. And a key part of the discussions will look at the lessons from the pandemic. So with this, thank you. We're very happy to launch this tool, and it will be available online. I believe Edith has already shared the link in the chat, and it's also available through the event page for today. Thank you.
Thank you, Tanya, for this sort of comprehensive overview of the plan, and well done for all of your work leading this from PRI's side. It must be a joyous occasion to see it out in the world, and we hope that everyone will find it useful in your work and access it through the link that Edith has shared. So we're almost at the end of the event. We have about 5 minutes. If anyone has any burning questions for any of the panelists, you're very welcome to put them in the Q&A, or participants can raise your hand and we can give you the ability to take the floor briefly if you have any thoughts or comments. Otherwise, I would like to put it back to open the floor to all of our panelists. If you have any takeaways from today's presentations or discussions, any sort of closing thoughts? Andres, I see one of our participants would like to contribute. I think you should be able to speak.
A question to all the speakers. In view of the prevailing climate, the restrictions on non-custodial measures in the countries concerned, has there been any attempt to use other measures like restorative justice, which lends itself to online meetings to overcome those difficulties? So the use of restorative justice, including online, as a way of overcoming the challenges posed by the pandemic. That's my question to all the speakers.
Would any of the speakers like to come in on that? Equally, any of the other participants on the call, if you have any comments, feel free to raise your hand.
I wasn't directly involved in many of the in-depth research activities, so perhaps my colleagues have something to say about this, but I wanted to say that there's definitely been discussions about restorative justice and its broadened role and applicability, for example, in a recent probation conference. But I haven't actually heard about the specific point you made about it being very suitable for video, which is interesting. Thanks for raising that.
Any other comments or thoughts on that? Otherwise, I might pass it back to Dr. Piet Hein van Kampen, if you wouldn't mind, if you have any closing thoughts or remarks, and Tanya, and then we'll wrap up today's discussion.
Well, thank you very much for that. Well, I don't want to speak too long after such a long discussion already. I think it proves that there's a lot of information. I can only invite everybody to carefully read the reports. They are really good. And to also take a very good look, more than that, to really study the 10-point plan, because I think it is an excellent plan, as I already said, and it is important now, and it is important also for the future. And it kind of revives the discussion on non-custodial sentences, of the importance of that. So in that sense, it always is valid. But what is more, it also triggers us to think what we need to do in our systems to make sure that if we are confronted with similar or different crises, how to respond. Because this crisis proved, as also the reports showed, that it was very difficult to immediately get a grip on the situation and be sure that you can still guarantee non-custodial sentences to be executed. So in that sense, I think it's very important that this plan will be disseminated widely around the world. And I can say that the IPPF will try to contribute to that. So thanks again for everybody involved in all the reports and all the research work, because it is really an excellent job as far as we are concerned. Thanks very much.
I think that's probably quite a nice point to leave it on, but Tanya, anything further?
Yeah, no, that's what I was going to say. I think I don't have much to add to that. Just thank you on behalf of, the whole project team as well, for everybody who has participated in the projects in one way or another and has contributed to the research. Thank you.
Thanks also to IPPF as funders of the project for making all of this possible. So thank you all for attending, and we hope you found it useful, and have a very good rest of the day. Bye-bye.